Hi, my name is Mr. Benji, Cultural Ambassador and lead singer for TK International. COVID-19 has hit my livelihood very hard. No large crowds means no shows. No live performances means no zero. I want to get back to doing what I love, to what you love. Let's get back to 13. I can only get back on stage if we all take the vaccine. Get vaxxed. Mr. Benji said so.
Hey, brother, I see people sanitizing their hands before they enter your bus. Tell the people of Dominica, why have you enforced this?
My bus is my livelihood, and that's why I make sure all my passengers wear the mask and sanitize their hands to stop the spread of COVID-19. We all are in this together.
You have heard it here first. Let's all join the fight against COVID-19 in Dominica.
So we are in the community of Bells today. We are going through a list, making sure the community has a certain amount of people that get vaccinated. So we are raising awareness as well as education, as well as meeting the people, find out their concerns, why they want the vaccine, why they're not taking the vaccine, if they'll encourage their friends to take the vaccine. So all this is part of our vaccination rollout campaign. So stay tuned for more, and remember, vaccination helps. Get vaxxed today.
Vaccine. Under COVID pressure in we country, mentally, socially, economically. Look, we get a blessing rather quickly to bring us back to some kind of normalcy. Yes, you over 18, take the vaccine. To protect your family, take the vaccine. To safeguard the elderly, take the vaccine. To bring back with festivals, take the vaccine. Take the vaccine, take the vaccine. Take the vaccine, take the vaccine.
Good evening, ladies and gentlemen, and as always, we thank you for taking the time to join us for this COVID-19 update. We're just about halfway through the official first week of school here in Dominica. And of course, this is a new era of learning, an unprecedented era. And that's why it's very fitting we have with us this evening the Minister of Education, Human Resource Planning, Vocational Training and National Excellence, Honorable Octavia Alfred, and also with us, the Senior Education Officer for Curriculum, Measurement and Evaluation, Mr. Robert Geist. We welcome first off this evening the Honorable Minister.
Thank you, Ms. Harry. I say good night to our Senior Education Officer, Mr. Geist, and to all our listeners, good night. The Ministry of Education, Human Resource Planning, Vocational Training and National Excellence was guided by the Ministry of Health, Wellness and New Health Investments and the Cabinet of Dominica as we commence the academic year 2021-2022. The government has enacted an SRO number 26 of 2021, which limits gatherings and orders that all places of instruction must remain closed. Additionally, we had to consider the vulnerability of our students to the threat of COVID-19. We have preschoolers, primary school students, secondary school students contracting COVID-19. We held on to the end to see if the conditions would be favorable enough to have face-to-face instructions, but COVID has not allowed us to do so. We have a system in place to engage our students in learning, and it is not perfect, but it is one that if we follow it well, our students will succeed. We assure our parents that government is playing its part, and the Ministry of Education considered all aspects of learning, all learning styles, and all learners, because we are convinced that learning must continue. From September 1st, 2021, school staff have been engaged in professional training activities online in preparation for a flexible approach to students' engagement. Numerous stakeholders sensitization sessions have been held, and these are still ongoing. We had a parental engagement this afternoon with parents from the North and the Northeast on addressing psychological challenges, online learning, and we had a general discussion on tips for students working from home. We have a schedule for these engagements for the entire term. There is a lead teacher at each school who have been providing continuous support and training to staff at their schools, especially as it pertains to online learning. From September 13, 2021, Form 5 students of secondary schools have been engaged in a formal framework, a structure developed especially for online learning. In addition to the Google platform, extended Zoom accounts are available at all secondary schools for online meetings with large groups of staff or parents. Our research then showed that there were 41 Form 5 students on the island with no device and no internet access. These students are accommodated at the primary schools in their communities from 8 to 1. These students, their numbers have dropped because the government of Dominica, through the Ministry of Education, has provided most of these students with devices, and we have been working with service providers to provide services in areas where there were limited connections. All reports for the Form 5 engagements were positive, and teaching and learning has gone on exceptionally well so far. We want to highly commend the efforts of our principals, teachers, and students, and also the parents of the Form 5 students. From October 4th, 2021, the term commenced for secondary school students from Forms 1 to 4, primary school students, and pre-K students. These students are learning from home. Secondary school students with access to internet and their own devices are following a structured format between 8 to 1, and primary school students with internet and their own devices work from 9 to 2. A timetable is being followed, lessons are recorded, so therefore, students who miss out can review lessons anytime. We have 282 secondary school students and 976 primary school students with intermittent access to devices and internet. This means that they do not have their own device, but they have access to a device, and or they don't always have access to internet. These students are engaged by their teachers at any point between the hours of 8 to 4. During these engagements, teachers interact with students and post work using various modalities, including explanatory notes, voice clips, video clips, data uploaded on data drives, and other creative means. Students download exercises on their devices and work on their own based on availability and access. They upload assignments and exercises on the system for feedback by their teacher. These students can also review recorded lessons taught previously by teachers. For students with no devices and no internet, this is about 186 secondary school students and 307 primary school students. This means there is no internet, not even a smartphone available to the students. We have a few cases where students do not have electricity because their homes are under construction or repair. I want to pause and to commend the parents who have made the effort in spite of this condition to get their children in class. It made my heart really glad yesterday when one teacher said to me, "Miss, my student who has no electricity is in class today." So it means that that number may have dropped since our survey. For these students, worksheets and activity cards with explanatory notes and instructions are prepared. Students or parents collect their work at their school, or the work is delivered to the students. We have made provisions for work to be taken to students where necessary. Upon completion of these activities, the students will return their completed work to the school for feedback. All students will be given exercises to complete from textbook, and they will complete projects based on various themes and subject areas. Arrangements have also been made for grade pre-K learners. Pre-K learners will engage online by their teachers. They will be doing work with their teachers as their circumstances allow. For songs and games and mini lessons, they will complete activity sheets which will be delivered to them or picked up by parents from school. When completed, this will be returned to school for feedback. I would just want to say that our hygiene wardens are still engaged by the schools, so people visiting the schools still have to follow the protocols and they still have to be sanitized by the wardens. We also have teachers of special needs. So special needs teachers were trained in Google Classroom, and they were also trained in another learning platform called Seesaw. Now, Seesaw is an online learning platform for students with special needs especially. 180 parents were also trained in strategies on coping with special needs students while they are at home. Other provisions for all students. A list of websites for learners of all ages is made available to students and parents. Hard and digital copies of printable versions of worksheets, all primary, secondary, and CSEC curriculum for all subjects, and other teacher and student resources are available and accessible to the public. Video tutorials will be done for all subjects and posted on various media platforms. Activities, lessons, explanations for all subjects will be posted on the Ministry of Education's YouTube educational channel. We have a number of documents that can assist parents on our website. A simple guide for families to implement active learning for early childhood is one of those documents. And we also have another document that you can also get from your school, which is called Guidelines and Protocols for Hybrid Education Program. All of these documents will be posted on our website and they'll be accessible for download by parents. The library service will also help to prepare packages for fifth form students on SBA topics. So they will prepare literature on the SBA topics to help our Form 5 students with their review of literature for their SBA. Supervision and monitoring. Teachers will keep daily student attendance log and ensure that students' learning is monitored and adequate feedback is provided on a daily basis. Principals will ensure that the needs of all students are adequately addressed by following up on absenteeism, teacher lesson delivery, and they will complete weekly reports. Ministry officials will review system for monitoring in light of the changing teaching learning environment and curriculum delivery. They are to provide daily monitoring of virtual platforms. So in other words, as the lessons are being taught, education officers can look at the lessons at the same time. HODs, principals can be looking at the lessons. Officers will ensure that our virtual database of activities always contain fresh activities and they're updated regularly. We have support staff who will continue regular training sessions to ensure that the challenges relating to teaching and learning are addressed. We have officers available on the ground who are troubleshooting, especially for technical problems with the internet. Yesterday, we got a report at 9 o'clock that there was no internet at Atkinson Primary. By 11 o'clock, Atkinson Primary had internet. Our counselors are also available, and we will activate our hotline again. So in case anybody has any stress whatever stress it might be. It doesn't even have to be school related. You can call our counselors and they can help to deal with the psychosocial part of it. So far, some of our challenges are power outage. Outages, not just one, plenty. We met with Domlec yesterday, and Domlec, they're doing maintenance work, and they have agreed to work on Tuesdays and Thursdays from 12. So our students can be online from 8 to 12, and they will work in the afternoons. We also have drop-in service. This is not exactly the Ministry of Education fault, but we are working with service providers to ensure that we improve this. We have lack of devices. We have been in the process of procuring devices for students since April. There were challenges with the providers. Some are ready for shipment, but shipment by boat will take too long, so we have asked that 1,000 devices be sent to us by air. So as soon as these arrive, they will be distributed. We want to thank all our parents, our teachers, our principals, our students, our officers, all stakeholders for your support in this time. It is a new thing for all of us, but this is truly what it means to prepare our children for the future. We understand the challenges experienced by parents, especially those who have to go to work, but we are all in this thing together. We thank all our teachers and parents who have taken the vaccine. I see this as your contribution to enable a rapid return to face-to-face instruction. God bless you. Jesus loves you, and I love you too. Good night. Take my 4 minutes.
Our sincere thanks to the Honorable Minister for Education, Human Resource Planning, Vocational Training, and National Excellence. Of course, every sector has been challenged by this COVID-19 pandemic, education especially. And the online learning and teaching system is not perfect, but assessments and improvements continue. So we thank you and your team for your efforts thus far. And as I mentioned, also with us this evening, we have the Senior Education Officer for Curriculum, Measurement and Evaluation, Mr. Robert Geist, our next presenter.
Good evening to you, Ms. Harry, our Minister, Mrs. Alfred, and the listening public. Let me take you back on a short journey, a journey back in time when there was no social media, there was no internet, and the outdoors was our playground. Our parents used to say to us, "Sortez un pied moins. Allez jouer dehors." And we would gladly run outside, run around, climb mango trees, go to the river, eat ripe fig and mangoes and coconuts. Then we grew up. We had our own children. We trusted when we were told that giving them vaccines was best for them. We never questioned our doctors. We never questioned our elders. We trusted the process. A time when immunization requirements were the rule and not the exception. A little fact, during the 2021 academic year, Dominica remained the only island in the region and probably the world to have full, uninterrupted face-to-face sessions. We were even spared from the ravages of severe weather, which we would normally get on an annual basis. Our children enjoyed being at school. They enjoyed being with their friends and the teachers. Our teachers enjoyed being with the children. They enjoyed the opportunity to teach those little ones. They enjoyed the opportunity to give them the one-on-one help that so many of them needed. our parents were happy that there was someone helping and having the children in a safe place while they were at work. It goes without saying that our schools are safe places for many of our children. And as such, we would love to keep it this way. The Ministry of Education would love to continue having that face-to-face session. Our social programs allow for students to be transported to school and back. And some of the students even received a meal or two while they were there. We would like to continue to keep it this way. We want our students to remain safe. We also want our teachers to be protected, because without them, we don't have a school. Over the past month, the Ministry of Education has received several sick leave applications from teachers who have been diagnosed with COVID-19. Some of these have been asymptomatic. As we speak, we have a few at the quarantine centers at Portsmouth, and some are actually undergoing home isolation. Unfortunately, we have even had one death from COVID. Also, over the past month, we have had 569 children between the ages of 0 to 18 years being infected with COVID. Many of them were asymptomatic. Had we gone back to regular instruction, can we imagine the number of other children and the teachers who would have been infected? Bear in mind that we have over 10,000 students at our schools. And from the information given to us by the Ministry of Health, the Delta variant circulating in Dominica at present is 60% more transmissible than the previous COVID-19 strain. And one person infected with COVID-19 has the ability to infect 8 to 9 people, as opposed to the 2 to 3 with the previous variant. We have spoken to our parents, to many of our parents, and they are feeling the brunt of online learning. Many of them are not very tech savvy. Many of them seem to have issues navigating the online platforms. Some of our children often have to stay home alone since their parents have to go to work. Further, the internet connections, as my minister said, at some of the homes are intermittent. There are homes with more than one child, but only one device. Again, we just listened to some of the challenges faced by the parents from our minister. These are just some of the impacts of the dreaded disease. Fortunately, the Ministry of Education has made arrangements such that some of our students are able to go to the schools to access their learning, because the internet at their homes are poor, and some of them, again, have no devices. But even that is to the extent where social distancing allows. Again, as our minister said, hopefully we will soon be making devices available to the students in need. Our teachers are missing the face-to-face interaction with the students. The job of teaching little 4, 5, and 6-year-olds are made even more difficult in an online setting. And we can imagine the amount of actual learning that is taking place. In fact, today, this afternoon, I met some teachers, and the biggest cry is, mute your mics, mute your mics, mute your mics. Our children need to play. They need to be outside. They need to get up and move about. Currently, we are working with the sports division to execute the programs in an online setting. And this is proving a tedious and almost impossible task. The harsh reality: COVID is severely impacting our education system. Our employers, our teachers, our parents, and most of all, our students. Hence, the only way that we can resolve this and get back to a sense of normalcy in our education system, the only way we can get back to face-to-face instruction is by trusting our medical professionals. That's the only way. We need to get vaccinated. The vaccines is in fact our best defense against COVID right now. Many students are too young to receive the vaccine. In fact, over 5,000 of them in our primary and lower secondary school. The only way that these students can be protected, therefore, is by our teachers receiving that vaccine. That's the only way we can protect them. That's the only way we can get them back to face-to-face instruction. Hence, it is imperative that our teachers get vaccinated. And not only that, but parents need to allow the children who are aged 12 to 17 years to get vaccinated also. As has been alluded to in several other forums, while the vaccines do not prevent COVID, we know that. We know that it is our best bet at preventing severe illness. We know that it is our best bet at reducing transmission and getting our students back to schools. Thus far, we have approximately 45% of our teachers vaccinated. And we really like to applaud those teachers and are grateful for the efforts at ensuring that our students get back to school. We are hoping that the remaining 55% will do the right thing in helping our students, in helping protect our students, in helping us get back to regular face-to-face instruction. Last week, my son asked me, when am I going to get vaccinated, Daddy? When am I going to get the vaccine? Because I want to get back out there to play volleyball. He did so on Tuesday. Many of my 53 volleyballers from SMA, Convent High, and the Dominica State College are ready and waiting to take the vaccine so they could get back to what they love. Again, vaccination is our best defense against the vaccine, against the virus. The Ministry of Education would like to urge parents to have your children vaccinated. Thus far, we have 1,115 students out of about 6,500 taking the first jab of the vaccine. And to date, there has been 0 negative effects reported. And as far as I know, there have been no chips installed in the children either. Those children are aged 12 and over. We know that some of you will say that all we need to do is boost our immune system and use the natural herbs we have. But let's be true to ourselves. How many of our children will drink verveine and lemongrass every day? How many of us will actually make the genuine effort to ensure that we boost our own immune system, let alone our children? The vaccines are actually a boost to our immune system. We trust our doctors for everything else. Why should we stop now? The fact is, we have been vaccinated all of our lives. We have vaccinated our children because we know they work. Having our teachers and students vaccinated is the only way to help protect them from the virus. This will help us again return to in-person teaching and ultimately keep our schools open. There is a lot of misinformation and disinformation out there clouding our judgments. When reading up on the vaccines, do not rely on Facebook and WhatsApp, but instead read medical journals that have been peer-reviewed. These are easy to find with a simple Google search. Conspiracy theorists use social media to spread the message. Medical experts use peer-reviewed journals. It is time to get back to school and to offer students the safest possible return and to ease the burden of parents. Every teacher who is medically able should be immunized against COVID-19. And parents should allow their children to take the vaccine once the child is able. What we are asking of you is nothing new. Our cases are not up to where it is right now because people took the vaccine. The sick at our quarantine centers are not there because they took the vaccine, because people took the vaccine. In reality, one of the reasons that students are at home doing online education is because we have not been vaccinated. Remember, we are all in this together. Please continue to adhere to all the COVID-19 prevention protocols recommended and mandated by the Ministry of Education. And I will repeat something that Sheena and the medical team has been saying all along. Wear your masks and wear it properly. Wash your hands with soap and water, or use a 70% or above hand sanitizer, 70% alcohol or above hand sanitizer. Clean frequently used surfaces as often as possible. Maintain your physical distancing, and we're back to 6 feet, not 3 feet. Eat healthy to boost your immune system. Drink lots of water, and most importantly, get vaccinated. Let us get back to what we love. Let our children get back to what they love. Let us get our children back in school, and let's keep our schools open. Thank you. Good evening. Stay safe. If you require any more information on the Ministry of Education, feel free to log on to ministry www.education.gov.dm. Thank you.
And thank you so much to Mr. Robert Geist for his presentation, an impassioned presentation this evening. We appreciate your time. We appreciate all of the hard work that you continue to do. And I know you, as an avid sportsman, you would certainly like things to get back to some form of normalcy. And of course, we continue to work as the Ministry of Health in conjunction with the Ministry of Education to provide opportunities for vaccinations. So barring any unforeseen circumstances, these are the sites for vaccinations for the remainder of this week. For tomorrow, that's Thursday, the 7th, at the Dominica State College, the All Saints University, the Penville Health Center, Trafalgar Health Center, the Egliston Health Center, the Doris Musgrave Health Center, the Dalis Complex building from 2 p.m., community drive-through will be held in St. Joseph and Taru, at the Bagatelle Primary School, at the Windsor Park Sports Stadium, at the Sensi Resource Center, and of course, at all the Type 3, that's the main health centers island-wide. Then on Friday, on the Bayfront in Roseau, near Fresh Market, at the Layu Resource Center, the Woodford Hill Health Center, the Laplane Health Center, the Casa Bruce Health Center, the Olivia Douglas Health and Wellness Center. Some stops will be made in Grand Bay at popular bars and shops, at the Warner Health Center, the Windsor Park Sports Stadium, and as always, all the Type 3 health centers on island. Once again, ladies and gentlemen, we thank you for joining us this evening. We thank our media partners, as usual, for their kind cooperation. We thank the Office of the Prime Minister for hosting us. And we ask you, again, to continue to adhere to the protocols and remain safe. Good evening.